quarantine and the countdown is on. Wish you were anywhere but here, perhaps. Tens of thousands of holidaymakers in France today facing a last-minute scramble to get any plane, train or boat home before the 2-week isolation rule comes into force in a few hours' time.
Opening the floodgates to allow us to travel, and then, of course, to then shut them so quickly is difficult.
It's unpleasant, it's very inconvenient, it's expensive, but it's necessary, I'm afraid.
Grant Shapps' response: the quarantine news should not, quote, entirely surprise anyone. With precisely that in mind, the Transport Secretary was asked today, why so last minute then?
Well, we got the data, for example, on France just yesterday evening at 5 o'clock, and then in the UK, the Joint Biosecurity Centre needs to analyse that and then provide advice to ministers. I'm gutted for people whose holidays are being destroyed, but it is important that we protect our hard-won gains in the UK.
From 4 a.m. tomorrow, France and the Netherlands have now been added to the quarantine list after their infection rates increased to 34 and 41 per 100,000. For context, the UK's rate is currently 17 per 100,000. 500,000 Brits are estimated to be in France on holiday. But it's not just them caught up. Any holidaymakers driving home from unaffected countries like Germany or Austria must not stop or get out of their vehicles until they arrive at the port, or they too must quarantine. France's Secretary of State for European Affairs, Clément Beaune, said the country would respond with the same policy, tweeting, "A British decision which we regret and which will lead to reciprocal measures. We are hoping for a return to normal as quickly as possible." As that news broke, this was the Eurotunnel website cueing the theme of the day as thousands tried to urgently make bookings. Meanwhile, on a campsite in the Loire Valley, Jo and her family are among the Brits who won't be rushing home anytime soon.
There's the tent. My boys at the moment are in the pool.
We're hugely jealous, but let's see the pool. Do you think it's an overreaction by the British government?
I do feel there is some overreaction. When you look at the numbers, yes, the number in France is higher. However, the area of land that people are covering is much more great. So I feel personally, my family are at higher risk in the UK of catching it, being in closer proximity to people than we are here.
While Jo may be philosophical about staying in sunny France, and who can blame her, tens of thousands of holidaymakers are now on their way home, as the group representing UK airlines call this another devastating blow for an industry already reeling from the worst crisis in history.
Well, the government says it's imposing the new quarantine rules to keep infection rates low. But the Scientific Advisory Group for Emergencies, or SAGE, has warned they no longer have confidence the R rate in England is below 1, the rate at which infections decrease. And in today's other developments, 11 deaths of positive cases were recorded in the past 24 hours, bringing the total number to 41,358. That's under the new system of counting. Just over 1,400 people have tested positive, and the restaurant chain Yo Sushi is cutting 250 jobs in a bid to protect its long-term future. Well, from tomorrow, some restrictions in England will be eased. Our reporter Anya Pop is at a soft play centre in Essex where they're preparing to open. Anya.
Yes, lots of changes in the past 24 hours here in England. We've heard lots about the quarantine, but for many businesses who have been essentially in lockdown for 5 months, they've got the day they've been waiting for and they can finally reopen tomorrow. Those businesses, so live performances can now take place, weddings with up to 30 guests, beauty salons can now do facial treatments, and businesses such as bowling alleys, ice skating rinks, tattoo parlours and soft plays like here in Lakeside, Essex can now reopen. And they've been doing everything they can here to get ready in time, but as with many of these announcements, they just haven't had that much notice to get ready. So here they say they won't actually be able to open until Tuesday, just so they've got time to get staff off furlough and to get all the systems back up and running. Now, these changes won't come into place in areas with local lockdowns. The government confirmed no changes on that front, so places like Leicester, East Lancashire, West Yorkshire and Greater Manchester. And elsewhere in the UK, Scotland have announced stricter rules for the hospitality sector, where it's a mandatory collection of customers' details. And in Wales, they're set to announce new rules this week. Now, you may remember these changes in England were due to come in a few weeks ago, and there was a dramatic change of plan, all called off last minute because of fears that the coronavirus infection rate wasn't levelling off. So concerns from the SAGE committee that you mentioned earlier about the R rate has got many people asking, well, what's changed now to 2 weeks ago when we couldn't open then? And one thing that will certainly be on the government's mind is now we are officially in recession, and that's a compromise that the government are going to have to be considering again and again, which is the health of the nation versus the health of the economy.
Anya Pop. Well, joining me now, Devi Sridhar, Professor of Global Public Health at the University of Edinburgh, and Kate Bingham, the chair of the government's Vaccine Task Force programme, who announced today they secured another 90 million doses of 2 prospective vaccines. The UK has now acquired the rights to 6 different experimental vaccines. Kate Bingham, I mean, is it possible that none of them work?
It's absolutely possible that none will work. We have no vaccine against any human coronavirus, and so we've got no template or past experience on which to build a vaccine for a new COVID-19 vaccine. So what we've done is to pick the best and most promising vaccines across the 4 different types of vaccine candidate and manufactured those ahead of time so that we will have vaccine available should any one of these vaccines prove to be both safe and effective.
It's still a question of when, isn't it? People had talked up maybe September, maybe before Christmas. It's not going to happen, is it, before next year?
It's not an exact science. I can tell you exactly how many people have been vaccinated, but the way clinical trials work is that in order to show whether a vaccine is actually effective, you have to show that those people who've received the vaccine are protected versus those people who have received placebo or no vaccine. And in the case in the UK, where social distancing has actually been very effective, if no one who's received either vaccine or placebo is actually exposed to virus, you can't show that relative difference. So the reason why you haven't got a precise date for when the trial is going to read out is because we don't know when people are going to actually get exposed to virus in order to demonstrate that difference between those who've been vaccinated versus those who haven't.
Well, Devi Sridhar, the infection rates are going up, aren't they? How worried should we be about the creeping R rate in England and this big jump in actual infections today?
Well, I think it's definitely concerning because, the key objective, at least in my mind, is to get kids back to school full time and get them back into the educational system. They've been out of school for months. And the worry is that if your community transmission increases, that means you're more likely to have outbreaks in schools. It's easy to open schools. It's very hard to keep them open if you keep seeing outbreaks, as we've seen in the United States. So I think they have to keep that number low and really be quite cautious on any further unlocking going into school reopenings in England in September.
You've been warning against booking foreign holidays for quite some time. Where's going to be next?
Yeah, no, I don't want to be a grouch. I mean, I know people want to have a holiday, but I guess, from the start, I think there's been too many mixed messages. It's been like, go abroad on holiday, then it's been don't go abroad. There's so much uncertainty. I think the recommendation should be don't travel right now unless it's absolutely essential. For those who are traveling, we need to be testing at airports, testing 5 days later, and actually trying to get people to, support the domestic economy, support their local shops, local businesses, which are hurting, and actually realize that they're tough trade-offs right now and we can't have it all. And so if there's something that has to give perhaps the least essential element right now, are holidays out of everything else.
Do you think there's a sort of a misguided confidence in the population that this is all going to be solved by a vaccine?
Well, I think all of us are hoping for some kind of solution, and it would be great if one of these vaccine candidates would work. I don't think it's going to be here in time for this winter. I think we need to prepare for having possibly more lockdowns this winter if the virus cannot be controlled at a low level. Even if we do get a vaccine, just getting one which is effective is half the battle. Another part of it is actually getting it out to people, manufacturing enough doses, making sure across the world enough people have access to it, and also that people accept it and it doesn't have side effects and it's affordable. So I think a vaccine is definitely a huge game changer, but it's not going to solve the whole COVID-19 crisis. This is a pretty massive, extraordinary event for the world right now.
Kate Bingham, I mean, earlier this week we heard Russia had approved its vaccine. Why can't we have that one?
Because by all accounts, the Russian vaccine has only been dosed into 38 people. And with the best will in the world, that shows neither that the vaccine is safe nor effective.
So you don't believe it?
We don't have any data. And in any case, that's insufficient numbers of people to demonstrate safety or effectiveness. So our vaccines that we've included in the UK portfolio have been dosed in several thousand people, and we're still not at the end to be able to show whether or not they're effective.
Kate Bingham, Devi Sridhar, thank you both very much.